The primary interest of my research group and the authors of this paper are looking at and performing randomized trials of phosphatidylcholine supplementation during pregnancy and how that impacts both pregnancy outcomes and child development. With folate or folic acid, the critical period is really preconceptionally up until the first trimester when the neural tube is formed. After that point, the neural tube is either formed and closed, or it can result in an open neural tube defect. And so what we know about folate is that it reduces the risk of an open neural tube defect in a fetus from about 1 in 1,000 to about 1 in 10,000, so a full order of magnitude of risk reduction. So in the case of other supplements, such as phosphatidylcholine, we know that the population prevalence of these disorders is much higher than the risk of an open neural tube defect. So for schizophrenia or bipolar disorder, something along the lines of 1 to 2%. Previous data in both the basic science and translational research worlds have demonstrated that choline supplementation may be preventive during a critical phase of fetal brain development towards reducing the risk of not only schizophrenia, but other psychiatric conditions like autism spectrum disorders, bipolar disorder, ADHD. So as a perinatologist or high-risk obstetrician, I'm often asked by patients and their family members about choline supplementation during pregnancy. And my answer to them is that yes, it is ready for prime time. We have no data to support an adverse effect of it on either mom or baby's health. And in particular in women who are vulnerable to mental illness from a family history, a genetic predisposition, excessive stress or stressors during pregnancy or prenatally, or an infection during pregnancy, all are known risk factors for subsequent development of schizophrenia and psychosis, then I certainly encourage those parents to consider choline supplementation prenatally. Is it as important postnatally? Our data suggests that no, the most important time or the most critical period for choline supplementation to positively impact fetal brain development and subsequent child neurodevelopment is the prenatal period.